Welcome back. Now, more than 600 delegates from 46 countries are in Cape Town, South Africa, for the annual Global Mental Health Action Network meeting. This is the first hybrid meeting that is a mix of in-person and virtual attendance being held by mental health experts post the pandemic to chart the way forward in advocating for mental health funding and awareness creation. Bridget Ngana has been following the proceedings from South Africa and now joins us live from Cape Town, as I had said. And Bridget, thank you for joining us. It's good to see you. And just to kick it off, what are some of the highlights that are coming out of the conference so far?
Well done. It's a very cold, it's been a cold day here in Cape Town, but a lot of issues coming out, and one of them being the legal ones. But just to give you a brief on what the World Health Organization says about the issue or the status of mental health in the world, rather, is that every year nearly more than 700,000 people die by suicide globally, and these are shocking statistics that the World Health Organization published in 2021 post the COVID-19 pandemic, and also that this suicide is the fourth leading cause of death in young adults and adolescents aged between 15 and 29 years of age. We also have statistics from the WHO saying that 2/3 of the countries that report these 700,000 incidences of deaths by suicide are in low and middle income countries, and Africa as a continent is one of them. But when we look at the African context or the global context, right now there are about 20 countries in the world that still criminalize suicide, where it is punishable by law, and these countries are mostly former British colonies, and so they have a colonial aspect to the criminalization of suicide. Kenya is one of those countries, and interestingly, we are talking at a time when the country that this law came from, and that is Britain, decriminalized suicide by 1961, and that is more than 5 decades in Britain. That is no longer an issue. And I spoke on the sidelines with the executive director for the campaign or the committee to protect, or the coalition for the prevention of mental health from Kenya. He is here in Cape Town, and he is part of the delegates who are part of this mental health network. And this is what he had to say about what Kenya is doing towards making sure it is no longer part of the countries, or rather in the league of countries that are criminalizing suicide.
Key omissions in the mental health amendment bill was the decriminalisation of suicide, which should have been there. And my organization right now is part of other organizations joined in a petition to decriminalize suicide, which is at the High Court of Kenya. And I hope we are going to have it decriminalized, because decriminalization of suicide encourages better health-seeking behaviors.
And interestingly, Bridget, as you know, Bwana Mutiso has been talking about, and as you alluded to, in Kenya, it is a crime to take one's own life. And actually in the law, in section 226 of the Penal Code, it states that any person who tries to kill him or herself is guilty of a misdemeanor and is liable to either imprisonment of up to 2 years, a fine, or both. And the minimum age of prosecution is 8 years old. So that is one of the concerns that have been raised by those who are championing for the decriminalization of suicide. Bridget.
Yes, Dan, and in the midst of all this status quo, what the world is waking up to in terms of mental health awareness, we also have success stories of countries that are doing it right. I think in a fortnight ago, Pakistan was one of the countries from Asia that decriminalized suicide, a step forward in trying to improve mental health access and also creating mental health awareness in that country. Also recently, Ghana is also among the African countries that has also moved forward in decriminalizing suicide. But I also spoke with the lead of the team that advocated for the end of the criminalization of suicide in Pakistan, and this is what he had to say.
Around 20,000 people died by suicide, and 120,000 people attempted suicide. There have been no prosecutions under the law. So what we hope that through decriminalization, first we'll have actual data of how many people are actually attempting it, because what I mentioned earlier was just approximate statistics.
Bridget, what about the funding conversation?
Yes, Dan, funding is something that mental health as a public health issue is still grappling with. This is a sector within the public health system that hardly gets the due diligence it deserves, because even in the Kenyan context, nearly half of everyone who goes to a hospital seeking medical assistance is having a mental health issue. And this is according to the Psychiatric Association in the country. So we see that even 1 in 4 Kenyans being told or being diagnosed or being reported as having a mental health issue being a key concern, and funding is one of the areas that the world is looking at improving on in terms of mental health, and hopefully it will also help in terms of addressing the issues and the burden of mental health across the world. So I also spoke with the head of policy and advocacy at the United for Global Mental Health on what they are doing to improve the funding for mental health across the world.
Well, I mean, the countries across Africa are quite similar to the situation across the whole world, to be honest, is that the financing that's currently available for mental health is so far away from what's needed. There's a huge financing gap, which means that those most in need of mental health support can't access those services. And that's actually replicated across the world, not just in Africa. Mental health is an issue that generally receives low amounts of funding compared to the actual need.
So Bridget, what should we expect for the next few days of the conference?
Well, Dan, one of the highlights also is getting to speak with the host country in terms of what it is doing or it has been doing in terms of ending mental health and stigma. In 2022, there was a Lancet Commission report that was done across several countries across the world. And in this report, the media was indicted in that 7 out of 10 people who are living with mental health illness found that the media is contributing or worsens mental health stigma and discrimination. The issue here that the world is meeting to look into is how can we end mental health related stigma and discrimination. And so the South African Mental Health Federation has been using storytelling as a point of advocating to end stigma and using people with lived experience being at the fore of this. So in the next couple of days, I'll be keeping tabs on having people with lived experience and how we can contribute as the media in improving mental health reporting devoid of the bias, because one of the things that people with lived experience say is that they're afraid to share their stories and also speak about mental health related stigma and discrimination, because in the media their portrayal has been very damning so far. And so it's a learning point also for me as a journalist, and in the coming days I'll be updating you on what steps can be taken from the newsroom and also in creating awareness about ending mental health related stigma and discrimination.